delighted to introduce our next speaker, Isidoros Papaioannou. As you can guess from
the surname, right? The surname.
The complexity of the name, he comes from Greece, and he's a Senior Principal Biostatistician at Novartis, where he supports the conduct and development of clinical trials. After finishing his PhD in Epidemiology, at the Swiss Tropical Institute of TPH in Basel, he went to work he transitioned into industry, and he worked as a data science consultant at PwC. But I will not reveal any further details about his career path. I'll let him speak about the exciting data-driven decision-making in healthcare. So, Isidoro, thank you for being here. The stage is yours.
My pleasure. Thanks, Athanasios. And thanks, everyone, for coming to my presentation. My name is Isidoros Papaioannou. I'm a Senior Principal Biostatistician at Novartis, and today I would like to talk about my career journey. Okay, so let me start by saying that the views and opinions expressed in this presentation are those of myself and don't necessarily reflect the official policy or position of Novartis or any of its officers. Okay? So having said that, the agenda is as follows. I will give a brief intro about myself. Then I will talk about the genesis of my career, that is my PhD, the solid rock, the building block, that is my time at PricewaterhouseCoopers, and finally where I'm now at Novartis. Then I will close the presentation with some personal reflections and takeaways. Getting to know me. So I'm a mathematician by training. I hold a master's degree in statistics from the University of Manchester and a PhD in epidemiology from Swiss TPH, that is based in Basel. After that, I worked for 2 years as a data science consultant for the pharma sector at PricewaterhouseCoopers. And after that, and now I'm currently a Senior Principal Biostatistician at Novartis. Okay. So let's talk about the genesis of my career, that is my PhD. I did that at Swiss TPH. For those of you that don't know, Swiss TPH, it's a leading international global health institute based in Basel, with almost 1,000 employees and presence in over 120 countries. They research on a vast array of topics, from parasitology and infection biology all the way to economics and health systems. But if you would like to categorize all these topics into 2 bullets, the first one would be the investigation of biology and transmission of pathogens related to neglected tropical and poverty-related diseases. And the other one would be the analysis of the distribution drivers of infections and chronic diseases. Okay? So my PhD in specific now, it was interconnected with the Sustainable Development Goals. These are 17 goals adopted by the UN member states in 2015. And the idea behind that is that each UN member state would do something to provide further peace and prosperity for its people. They're due in 2030, and one of those goals is the reduction in the under the age of 5 mortality. Unfortunately, the sub-Saharan Africa region is the most afflicted region globally in terms of under 5 mortality, and past trends suggested that the African continent will not meet the under 5 mortality reduction target. And on top, you have an uneven distribution of mortality and of how health interventions are allocated in space, which ultimately results on health inequalities. So to this end, the goal of my PhD was to provide additional evidence to health institutions and policymakers on where to prioritize their funding and health interventions in Africa. And to do that, I developed Bayesian geostatistical models and utilized approximately 1 million individual-level survey data to estimate spatio-temporal changes in under 5 mortality. Some of the implications of my PhD. I proposed novel health indicators when modeling under 5 mortality. That was a statistical topic. Then I identified health inequalities at national and the subnational level, and I mapped those in the way that you see on the right-hand side of the slides. And finally, I provided updated estimates of the contribution of leading under 5 mortality causes from the African continent. Okay, that was my research. But actually, academic research is not really what I wanted to do. My goal or my wish or my ambition was to become a statistician in clinical development. So after that, I started applying to basically all the pharmaceutical companies in Switzerland, but to my surprise, I landed a job in the consulting sector. So now we'll talk about my time at PwC. So PwC is a professional services network. For those of you that don't know it, essentially they come as an external vendor and they offer some sort of service to your business. They are huge in accounting and law, but they offer all sorts of services from audit to deals, business strategy, tax, forensics, consulting, you name it. They have offices in all major Swiss cities, and in the French-speaking part of Switzerland, they're based in Lausanne, Geneva, Sion, and Neuchâtel, in case you're interested. So I was employed by the consulting organization. Within the consulting organization, there were different units. You see those on the right-hand side. So basically, there was the strategy unit, deals, cloud, risk management, financial consulting, and so on. I was part of the data and analytics. Within the data and analytics, we're offering the 4 solutions that you see with bullets on this slide. So that is data strategy and governance, consulting on data platforms, offering data insights and data automation solutions, as well as consulting on how to apply artificial intelligence. And then within the data and analytics, we were separated into different teams per industry. So we had the pharma team, we had the supply chain team, the finance team, the ethics team, and so on. Okay? So I was part of the pharma team, and a little bit about it. So it was a team of 10 people. All of us had a PhD. Our background was on stats, AI, or computational biology. 7 out of 10 had a PhD from ETH. And basically, we were offering the solutions that you see at the bottom of this slide, a little bit of everything on the real-world evidence sphere. So that would be predictive modeling to support pharma, epidemiological forecasting, regulatory evidence generation, real-world data, and health economics. Okay? So if you are interested in those, we can talk about it later, if you want. Overall, I would say that my time at PwC was a fantastic time. Consulting is just a great place for networking with industry clients. You experience both front and back office work. Front office work would mean that you sell projects, that you talk to clients. Back office work would mean that you do your data science research. So you see both worlds. It's a very dynamic, very rewarding environment, and there are great opportunities for switching roles or even industries. So Price would recommend you and support you to do projects in supply chain and finance if you want to. Okay? So it was just nice to see what there is out there. But again, doing consulting for pharma was not exactly what I wanted to do. I really wanted to work for the pharmaceutical industry. So after 2 years with PwC, I started applying and I landed a job where I'm now at Novartis. So Novartis, together with Roche, are the 2 largest pharmaceutical companies in Switzerland, and Novartis is among the 10 largest pharmaceutical companies worldwide, 78,000 employees, 120 countries, more than 250 million patients reached annually. Novartis used to be a conglomerate. This would mean that we're basically doing research in virtually any therapeutic area, utilizing any technology platform out there. But now the strategy of the company changed, and we're now a focused medicines company. This would mean that we now do research in 4 core therapeutic areas. These are cardiovascular, immunology, neuroscience, and cancer. And we just focus on 5 key technology platforms that you see on this slide. And we think that with this updated focus strategy, we'll deliver the most to the society and to our stakeholders. So Novartis is organized the way that you see on this slide. At the very top, you have the different Novartis organizations. This would be biomedical research, full development, commercial, international, and commercial US. So biomedical research is responsible for the discovery of new health interventions and preclinical testing. Full development is responsible for phase 2 and phase 3 studies, as well as supporting with registration and submissions. And then commercial is responsible for informing the health community about the new health interventions, as well as selling our products. So where you will find me, I'm a trial statistician for phase 3 and open label extension studies in full development. So what does it mean to be a trial statistician? This means that at any given time, I support several trials. One clinical trial is organized the way that you see on the right-hand side of this slide. So each clinical trial has its statistician, that's me, a programmer, a project manager, somebody from regulatory and safety, a medical writer, and many managers like data manager, vendor, site manager, and so on. So it's a cross-functional team. We all come together to design, conduct, and report a clinical trial. Each one of us has unique expertise, unique responsibilities, but it's a collective effort to push the trial forward. Okay, so I just thought of giving you a glimpse of what I do during the different phases of a clinical trial, but if you would be interested in more details, we can discuss later about those. So during the design stage, that is from the very beginning until we recruit our first patient, I'm responsible for proposing the quantitative methodology, which will be followed. I support with sample size calculation. I define the data collection and validation steps, as well as I interact with health authorities. During the conduct of the trial, that is after we have recruited all our patients and until the end of follow-up, I prepare analysis-ready data sets, I support with code development and validation, and finally I provide input on data-related issues as needed. And then after we have followed up all of our patients, in the reporting phase, the programmers are responsible for generating the outputs, and I have to validate those. I support with the interpretation of the results, and I also support with report and manuscript preparation so that we inform the health community. Okay, so overall, Novartis is a great place to work. I would highly recommend that you see open positions and apply. Some of the positive things for working at Novartis you can see on these slides. There is a very direct, rewarding impact at what we do. Innovation is at the heart of pharma. There are various career paths and excellent personal development opportunities, and we work internationally in global teams. Okay, I would like to close my presentation with some personal reflections and takeaways. When I think of my career, I would say that I could summarize the key things that I try to implement on these 4 bullets. So at what I do, I always try to find motivation and strong drive. I think this makes me productive and really motivated. I try to build trusted relationships with my collaborators. This makes my work really easy. I try to be open-minded for new opportunities. And what I think is very important is to set achievable milestones and take incremental steps as needed to achieve your goals. And with that, I would like to thank you very much.